Hello and welcome to Ask China. I'm Wang Mengmang in Beijing. Now we provide this important platform to raise your questions to people in charge. And joining us today is Ms. Song Shuli. She is the spokesperson of National Health and Family Planning Commission. Welcome to Ask China, Ms. Song. So we understand that a lot of progress has been made in the past few years in the healthcare reform. However, we also know that some people in the remote rural areas couldn't afford going to a doctor. So what are the major tasks you've completed to help these people to seek better health care?
President Xi Jinping said that we cannot build a prosperous society if we aren't able to ensure that every Chinese person is healthy. The concept of a healthy China was also put forward by Premier Li Keqiang in this year's government work report. That we should make health a state policy is a huge topic and something that benefits the people. As you mentioned, we have established an all-coverage medical insurance scheme. This is a relay-like system. First, we have basic medical insurance, which covers all rural and urban residents. We also have a medical insurance system for employees in urban areas. Through this, we have achieved 95% coverage. Despite downward economic pressure this year, the government has raised the basic welfare allowance from 320 yuan to 380 yuan on a yearly basis. Although the figure is small, the fact is that not everyone is sick, and this is only the most basic protection. For people with serious illness, we provide high-level insurance for residents in both urban and rural areas. Based on local economic development and average income levels, if the number of people affected by a type of disease exceeds a certain level, we increase their allowance by 10 to 15% to cover their medical fees. In NCMC, there are 22 serious diseases which affect people's health. For these diseases, we have clear treatment and successful results. For instance, congenital heart disease and leukemia seriously affect children and their families. The social influence is bad as well. We provide good treatment to those children so that they can live a new life. This is a high-level illness insurance for both urban citizens and rural residents. We have another emergency illness assistance program for people who do not have income or their carers cannot afford our medical expenses. They should still receive treatment if they are sick. The government allocates a portion of capital to set up an emergency assistance system for these people. According to the system, no hospital is allowed to decline to treat these people without qualified reasons. The expenses occurred in the most crucial stage of the treatment is covered by the government, but this is only temporary. Additionally, we have a social security system and charities that provide services to those in need. In this sense, we call our medical insurance system a relay. This system can cover the whole population so that no one will be left out. President Xi Jinping requires that our commission ensures people feel the tangible benefits reaped from the reform. That is to say, the sick should be able to afford their medical fees and have access to quality medical resources. This is what we're working towards now.
So in the past few years, we've seen that medical sales personnel tend to bribe doctors to use their prescription rights to boost their sales. How bad is the situation, and what is your commission doing to help this situation to further spread in China's medical system?
Since ancient times, we have valued the professional ethics of doctors. As the department in charge of health, we have always cracked down on misconduct in medicine purchases and sales, including commercial bribery. We aim to strengthen discipline through institutional building and enhance moral building, so that nobody in the industry dares or wants to corrupt practices. First, they do not dare to corrupt. After the establishment of NHFPC in 2013, we released 9 prohibited practices in the medical and health industry. The 9 practices are in fact nothing new, but a clearer version of the moral requirements in the industry, such as no red envelopes, no kickbacks, and so forth. With these strict disciplines, few dare to corrupt. Each month we release a list of names of people who break the 9 prohibited practices. They then receive due punishment and are deprived of their licenses. We also release the list of hospitals that have broken regulation. For each quarter, the NHFPC website gathers these lists and makes them available to the public. We are using such systems to cage misconduct. We investigate these cases and we publicize them. In this way, there is great pressure to check the misconduct. Second, they are not able to corrupt. Institutional building is important in this regard. For instance, we adopt a pathway method in treating certain diseases. So we determine the clinical pathway. That is to say, how do we treat this disease and what medicine should be used? There is a planned procedure. In addition, we strengthen education and emphasize professional ethics. On the one hand, we promote positive examples. For instance, CCTV has done a great job in producing the program The Most Beautiful Doctors. Previously, it was The Most Beautiful Rural Doctor. Now we have expanded it to The Most Beautiful Doctor. Such positive examples tell people what is right. On the other hand, we disclose negative examples. We use them to tell people what is wrong. Through informing the public of do's and don'ts, we ensure the integrity of the whole industry. We consider this case as it stands. We punish commercial bribery, be it a Chinese company or a foreign company. We regard them as equals. If a company is free of bribery, we will protect their legitimate interests, be it a Chinese or a foreign one. We help them to grow to be better and play a role in serving the people. It does not make any sense to believe our regulation and governments of corruption will hinder the inflow of foreign capital.
So China's one-child policy has been in place for 30 years, and the government has decided to loosen it to a little extent. And in year 2013, it started to allow parents who are the only child to have a second child if they're the only child in the family. So do you think that we can expect a complete change in the family planning policy? And have we seen this baby boom yet?
In 2013, the third plenary session of the 18th CPC Central Committee decided to relax the one-child policy, which was well recognized by relevant departments and the public. Some provinces, such as Zhejiang, started to implement the policy in January, which was quite soon after the meeting. By the end of September 2013, all 31 provinces had implemented the policy. There is a figure. By the end of January 2014, there were only 115 couples who were eligible and applied to have a second child. It takes time to see changes in the birth rate since pregnancy takes 9 months. People not only welcome the new policy, at the same time they were well prepared for the policy as well. So currently, we believe the policy has achieved the expected result. However, we should be aware that China is the most populous developing country in the world, so the pressure on resources as well as economic and social development still exists. So we should uphold the basic state policy, namely the family planning policy as stated in the third plenary session. But never forget there is another sentence following that statement, to always improve the birth policy. It means that we will continue to study demographic developments and trends. We have a mature model for demographical research. It can follow developments over the next decade, even decades, so that we can predict when we will meet the population peak. At present, it's estimated to be the year 2030. Population growth is a very complicated thing. I'm not an expert in demography. They tell me that it's an application of micro-issues. Collecting different demographical models together leads to a conclusion. So we need to adjust our birth policy based on demographical needs. The relaxation of the one-child policy does not reach its end. As for a complete relaxation of the policy, our government has prepared for it in advance. We will adjust the policy based on change. The eventual goal is to achieve long-term and balanced demographical development, as stated in the third plenary session. In terms of policy, we focus on stability, quality, and structure of our population's development. As for a complete relaxation, I believe that day is coming soon, but the principle of studying demographic trends is important. The government and medical institutions are prepared for that day. Once the policy is completely relaxed, pressure on maternal and healthcare, education, and employment will increase substantially, which needs resolving. So we should be prepared in terms of infrastructure. Individuals should be prepared as well. Young people should have a healthy body so that they can have a healthy baby if they want to. To raise strong children, a healthy baby and mother, and a harmonious family are our sincerest wishes. Even though the policy permits a family to have 3 or 4 or 5 children, they are under the family planning law when the couple decides to give birth to children. Just as I mentioned before, the pressure long exists. China is a populous country with limited natural resources such as water, land, and grain output. We need to treat demographical problems seriously. It's a problem of strategic security.
So pollution has really taken its toll on China. It's a key concern for people in China and also the Chinese government. So is smog the cause of the increasing number of cases of lung cancer, lung diseases, and even cardiovascular diseases?
雾霾呢是肯定有害于健康的，这个问题呢是毋庸置疑。
It's obvious that smog harms people's health. The Chinese government and many experts have called for the reduction of smog to protect people's health. In this regard, NHFPC has done the following work. First, supported by central government, we have set up 77 monitoring points in all 31 provinces in China. By acquiring this data, we will be able to learn about the relationship between smog and health. Single samples cannot explain the whole situation, so the 77 monitoring points work day and night to accumulate data for scientific analysis. Once the conclusion is drawn, we'll set up a threshold. Second, we run research projects for public benefit. Through the research of scientists, we can learn whether smog has direct or indirect influence on health. Third, we promote health education. On smoggy days, what should individuals do to protect themselves? What should the elderly and children do, as they are the most vulnerable? What should people who work outside do, such as policemen, construction workers, and sanitation workers? We provide them with necessary knowledge through education. Fourth, we strengthen guidance of local authorities, as many decisions made by the central government rely on local authorities for implementation. So we'll enhance our supervision on local authorities. Tackling smog needs participation of the public as well as the coordination of different departments. We, the NHFPC, will do our part to protect people's health. In my point of view, human society is a complex organism where relationships between different things are not linear. That's why we say something is the last straw that breaks the camel's back. Indeed, the prevalence of cancer and cardiovascular diseases is rising, but it comes from both social factors, such as too much pressure from work, and individual factors, such as an unhealthy lifestyle. Nowadays, people eat more while exercising less, which increases their chance of getting a disease. Another reason is that in recent years, we have increased awareness of mainstream and cardiovascular diseases. This does not mean that more and more people are affected with such diseases. In order to improve this situation, both the government and the individual should work hard. People should lead a healthy life, do more exercise, and eat, smoke, and drink less. By doing so, we'll all be much healthier. They are simple, but they can make a great difference, not only in improving an individual's health, but also lightening the social burden.
可以大大的减轻社会上的疾病负担。
So figures show that 62 million people in China are obese, making China the second on the list right after the United States. Can you confirm that number? And what do you think is the cause of obesity? What could be the solution to this problem?
其实这个问题呢，可以接着刚才的那个问题。
This question is related to the previous one. I've repeated that people should be responsible for their own health. I want to advocate a slogan: I am the master of my own health. I mentioned the importance of health at the beginning of the interview. This year's work report also proposed building a healthy China. To have a healthy China, we first need to have healthy Chinese people. To improve national literacy on health, we have formulated plans, allocated funds, chosen demonstrative counties, and promoted education on health. Let me begin with the plan. In the 12th five-year plan, we made people's health literacy an important component. I believe in the 13th five-year plan period, the standard for people's health literacy can only be raised to a higher level. It will be neither lowered nor disappeared. Based on the 12th five-year plan, we published an action plan to improve Chinese citizens' health literacy. We need this action plan to make sure that what was prepared in the 12th five-year plan are properly carried out. We are also monitoring people's health literacy. Here I think the term health literacy needs some explanation. Health literacy means that, first of all, you should know what kind of activities are healthy, and you should equip yourself with some basic health knowledge. Second, when you want to acquire further knowledge, you should know where to get relevant information. Third, you should know how to transform your knowledge into action. Knowledge, information, and action together are the basic requirement of health literacy. I think people working for CCTV have better health literacy. We've been working on smoking control for some years. Many people know that smoking is bad for their health, but they just can't quit it. When several smokers get together, they can't help but take out a cigarette. This is because they lack health literacy. Knowledge on its own is not enough to promise health literacy. We need to have a concrete action plan on building up health literacy. How do we improve people's health literacy? We need to spread the concept of health literacy by telling people what kind of lifestyle is healthy and equipping them with that knowledge. This is an area where CCTV has a role to play. Our data shows that television is the first source of health information for most people. Many elderly people pay great attention to their health, and they also love watching TV. Now many young people get health information from the internet, but generally speaking, TV stations are still the most credible source of health information. I do hope CCTV can do more on this. You can play a bigger role. We also have education plans and programs to improve people's awareness on health. We have set demonstration counties and areas for these programs. If education activities in certain area are outstanding, if the environment there is sound, and if people there have good living habits, if the incidence of disease there is at a low level, we can make that a demonstration area. We also introduced 66 health cues in 2008, telling people what they should know about health. For example, people sneeze when they are allergic to something or catch a cold. We should tell them how to sneeze safely when they are in a crowd of people. It took the US more than a decade to correct the way their people sneeze. Only TV stations are in the position to tell people how to sneeze safely, because everybody watches TV. If we can correct this in our generation, our children and grandchildren will all benefit. This can help improve the health literacy of the whole public and lower the incidence of disease. An aging society is becoming more real. The proportion of people above 60 or 65 years old is very high. The number of people above 65 has exceeded the population of a small European country. However, does aging mean happiness? Does it mean the country is in a good condition? No. We are now proposing to build a healthier aging society. If we are still healthy as we become old, then we have real happiness. Our target for health literacy is to reach 10% by 2015 and to reach 20% by 2020. Although by 2020 we are already an all-round moderately prosperous society, our target for health literacy can only be set at 20%.
Let's talk about the tobacco ban. When can we expect a complete smoking ban in public? And also, will your ministry consider putting warning signs on tobacco packages?
We've achieved a lot in banning smoking. By the end of December 2013, the General Office of the State Council and the General Office of CPC jointly published a notice, which is about party members and leaders taking the lead in banning smoking. Considering the status of these two offices in our country, this is indeed exciting. To implement this notice's requirements, we have done a lot of work. The fourth plenary session proposed to implement the rule of law. Thus, to ban smoking, we need to start from the legal front. We did two things last year. First, when amending the advertising law, the NHFPC and certain experts pushed to further limit tobacco and cigarette advertisements. At the beginning, some stakeholders did not agree on being so hard on these advertisements, but their opinions were met with strong opposition from dozens of experts who insisted on limiting them to the greatest extent. We are glad to see that these suggestions have been accepted by the legislature. Now the amendment of the advertising law is in the final stage. The other thing is our rules about restricting smoking in public areas, whose drafting is led by NHFPC. In both developed and developing countries, controlling smoking in public areas is supported by the law. As such a large economy is on its way to rejuvenation, we should make our nation a civilized and healthy nation. Banning smoking in public areas is an action that is both healthy and civilized. As we tighten controls on smoking, we are supported by many law-related departments, and the good news is that we're warmly welcomed by the general public. Now the drafted document is seeking public feedback. I expect that it will come out this year. If it's so, we will ban smoking in public areas and in any place with a roof. For example, smoking will be forbidden in health centers for women and children, in hospitals, and in waiting rooms. In addition to promoting relevant legislation, the NHFPC also encourages pioneers of this move to set an example for others. We take actions to build smoke-free family planning institutions and smoke-free government agencies. Some journalists with the Xinhua news agency once made a secret visit to the NHFPC office and published an article afterwards. The article said that neither cigarette smells or cigarette stubs were in our office, except for one found on the staircase leading to the rooftop. This article was published 3 years ago. Now our office has improved a lot. It's the same thing with medical institutions. We aim to build smoke-free hospitals. We welcome media supervision in this. You can make secret visits if you want. If you find people, NHFPC officials and medical workers in particular, smoking at these institutions, you can expose them, and we will deal with them. However, there is bad news as well. During the 2 sessions, some representatives proposed to serve the people's health by developing a tobacco business, which is ridiculous. Others proposed to reduce the content of tar in cigarettes to the lowest level in order to make smoking less harmful. But the shared view is that if you want to be healthy, then you should not smoke low-tar cigarettes and stop smoking altogether. Besides, there is no evidence proving that the so-called low-tar cigarettes indeed have low-tar content. I hope the media can tell the public that banning smoking is the ultimate way of improving people's health. Banning smoking can also help us to fulfill our positions to the WHO. As a responsible country and as a signatory, we would honor the WHO Framework Convention on Tobacco Control.
So organ donation and transplantation is a very sensitive issue in China. The government says it will end its reliance on organs from executed prisoners. So do you think that will mean that organ shortages will worsen? And what causes the low organ donation rate in China? What does your commission do to help change that situation?
Organ donation and transplant requires delicate procedures, which often trigger complicated social and ethical debates. The situation in foreign countries cannot be grafted in China. We must consider our own culture and national condition and make regulations based on the capability of our own medical institutions. In a 2005 WHO conference, China told the world that we would rise up to the new challenges in organ transplantation and would reform the transplantation system. In 2006, we launched regulations to monitor and regulate institutions doing organ transplants, and we also held the first National Summit on Organ Transplantation. During that conference, we announced the Guangzhou Declaration, showing the world our determination in reforming the organ transplant system. In 2007, the State Council published rules and regulations on human organ transplant, which brought it to the legal path. In 2007, we cut the number of hospitals doing organ transplant operations from more than 600 to 169. This is because hospitals need to be qualified enough to do such operations. We also banned people from traveling to our country for the sake of transplanting organs. In the past, some foreigners traveled to China for new organs. This is not allowed. For any country, organs are precious resources that are ethnically sensitive. They should first be transplanted to our nationals. In 2010, there were new developments. The highest people's court announced the amendment to the criminal law, which made the trade of organs a crime. Thereafter, criminal cases concerning organ transplant have a legal basis. We established a combined standard for brain death and circulation death. The international community allows organs to be collected if the patient is brain dead, even if his or her heart is still beating. However, it's hard to do so in our country because people feel their loved ones are still alive if their hearts are still working. However, the organs of brain-dead patients have blood flowing through and are thereby of high quality. If the patient's hearts have stopped beating, their organs are not as desirable. So we take both types of death into consideration and formulate a Chinese standard which has already been recognized by the international community. According to the standard, if the patient is medically dead, his or her organs can be collected directly. If she or he is brain dead, we can collect their organs after the hospital and the patient's relatives sign their consent. This is a realistic standard. In August 2013, NHFPC published a pilot regulation on the harvest and allocation of donated organs, which made our organ donation and transplant work more operational. In November 2013, we announced the Hangzhou Declaration, stating that China will stop collecting organs from executed prisoners. We are now entering a stage where voluntary donated organs are the major source for organ transplantation. Data shows that by December 18, 2014, altogether 3,061 patients donated their organs. Since one patient usually donates more than one organ, altogether 8,104 major organs have been donated. In the year 2014 alone, 1,613 patients donated their body parts, meaning the year 2014 contributes to over half of the 3,061 cases. Since 2006, when the Hangzhou Declaration was made, a famous Chinese singer donated her organ, and a French boy who died in an accident in China also donated his organs to Chinese patients. We should pay him our sincerest respect. And his case shows that the international community now has confidence in China's organ donation and transplant system, believing our system is transparent and credible. This is why the French boy agreed to donate his organs here in China. The latest development in organ donation, which has received much public attention, is that from January 1st to March 1st this year, already 381 Chinese citizens have donated their organs. The number 381 has doubled the 2014 level. It shows that the donation of organs is transparent and hopeful. According to the regulations on organ donation and transplantation, which we've just mentioned, we must supervise behavior of doctors and hospitals. We should ban unqualified hospitals from doing transplant operations and monitor their daily activities. We'll publish the names of qualified doctors and hospitals so that the public knows which hospitals can do such operations. If any illegal case emerges, we will deal with them by law. The trading of human organs in the black market is against the law. The criminal law has already made the buying and selling of human organs a crime. If you're really interested, you can take a look at our grassroots units. I believe that the public will support and participate in our work if they have confidence in us.
And that's all we have for this edition of Ask China. Please send us your questions, and we're going to raise your concern to other officials.